TCB program on WAVS Radio kicks off this morning by saying hello and good morning to Marissa Hylton. Good morning.
Good morning, Winston. Thank you so much for having me here.
I know it's not your mom, but you sound like your mom, so it will work. Okay?
Yes.
And you are here to talk about what? Tell us.
I am here to talk about Smileys Voice Foundation and our upcoming health fair that we have here in the city of Tamarack. We have partnered with Commissioner Maury Wright, and this is our third year that we're going to be in the city
In that
of
city,
Tamarack.
okay.
hmm
But tell us a little. This health fair has been going on for years.
Yes, this is actually our 12th annual Stroke Awareness
Okay.
Health Fair and Family Fun Day. So we are so excited. A little bit about our organization. We are a stroke awareness and prevention. We are 501c3, and we started um, in 2010 after my brother, Michael Hylton Jr., also known as DJ Smiley, passed away from a stroke at age 29 in 2009. So we are trying to continue his legacy by doing this nonprofit and spread awareness about stroke and how to get help. And the health fair is a part of our mission.
Right. One of the really cool things that has happened over the years is that people come, you actually call it a fun day as well, but people come and get valuable information about their health.
Absolutely. So the best part about this health fair is that it is 100% free for the community, and it is a wealth of information that they are going to be receiving. We also partnered with the Memorial Healthcare System.
As always.
Yes, and they are going to be out there providing free education. We're going to be having access to physicians, so anybody that needs some questions to be asked. Pharmacists will be out there to provide information. If you have medication that you have questions about, you may not have insurance, but you want to get a medical professional to give you some type of advice, they will be there for you. We have a wealth of free health screenings, blood pressure monitoring, we have cholesterol screenings, blood sugar. We have infection control demonstration that will be provided there as well by Joy McMillan. She is fantastic with that. So we have quite a few things that are going to be in the health fair that we're looking forward to people in the community to take advantage of it.
One of the things people are saying, listen, yes, yes, but when and where? When and where?
Yes.
Okay.
So we are having the health fair on May 16th. That's May 16th. It's a Saturday at 11 a.m. until 4 p.m. at the Tamarack Recreation Center. The address is 7501 North University Drive, Tamarack, 33321. We will be taking over the field for the children activities, and then we will be inside of the recreation center where all our vendors and our doctors and medical professionals will be in there to provide that information to the community.
And just so we expand what we're talking about this morning, stroke is no respecter of people. If you talk about your brother, for example, 29, talk about what this program that you and your family have been a part of all of these. Talk about how it has changed thinking in the community.
Absolutely. So years ago, there was a law that you needed to take your loved one to the
Nearest
nearest
hospital,
hospital.
right?
And part of the problem was that all hospitals, unfortunately, are not
Not
created
the
equally.
same. Hmm.
There are different tiers, different levels of hospitals, and different levels of care that each hospital is able to provide. So if you're going to a hospital and you're suffering from a stroke and they're not a stroke center, then your chances of recovery is not as high as if you would go to somewhere that is equipped for that. So over the years, we've advocated for that to be changed, and we've also partnered with hospitals in order to make sure that people are getting sufficient care, which is why we've partnered with Memorial Healthcare Systems, and they have been extremely supportive over the years, especially Dr. Ojiboye, who has been hand in hand with making sure that stroke victims get the proper care that they need, and they have been 100% supportive of all of our initiatives as well. We've been in contact with the University of the West Indies in Jamaica. We provide scholarships to the students there, the doctors and the nurses at that facility. We also are a part of the stroke initiative that they have there at the actual hospital in Jamaica. We provide financial support to them. The memorial team has gone down there and actually done quite a few medical procedures there. Our foundation is the only stroke awareness foundation in the South Florida area up until probably Orlando. So we are really trying to make sure that our community, especially the African American and the Black community, understand the importance, because we are highly affected by this disease.
And one of the things we've come to understand over time is that, okay, you need to look for signs that a stroke is present.
So with a stroke, they have a acronym that is called Be Fast, right? So you want to check for the B stands for balance, loss of balance or dizziness. E is for eyes. Is there any vision changes? Face is for the F. Is there any facial drooping, any severe headache? A is for arms. Is there any weakness in the arms? Any numbness? And the S is for speech. Do you have difficulty speaking? Any confusion? And then T is one of the most important, time. Immediately, when you're feeling any of those symptoms, and no matter how light you may feel they are, 911 is going to be the best number to call. Do not drive yourself to the hospital. Do not drink some ginger tea and lay down. Okay?
Gosh, yes.
I know we feel that tea solves a lot of the problems.
Sometimes
but
it does not.
No, it does not. In this situation, the 911 is going to be your best help. Reason being is, I don't care if you live 2 minutes from the hospital and you can get there. The time is the most important thing, and the emergency ambulance, those responders have techniques within that ambulance
that you don't have
in your car. So they're able to connect you, give you some type of medications, get your vitals under control until you get to the desired location that is equipped to handle a stroke. And then you can let them know, please take me to this hospital because I know this hospital is a stroke center. If you're able to speak or someone is with you that's able to guide them on where to take you. But most of the EMS know at this point that if they do recognize that you're having a stroke, they will take you to the nearest stroke center.
That is so important. And as you said earlier, this is something that has come over time.
Yes.
Where people would automatically bring you to the closest hospital when they might not be able to help you.
That's true. That is very, very true. And when that happens, your recovery is delayed. If there is a recovery, because there's different levels of strokes, you can have a mild one, you can have a very severe one, but you want to make sure you're in the right place. And that's what we've been doing with Smileys Voice. We've been educating the community on, one, first and foremost, understanding the signs and the symptoms, what you need to do in order to make sure that you're healthy, and if you do have those signs and symptoms, where you need to go. Our health fair is an extension of that. We are going to have a physician's corner. We're going to have the doctors there and on a panel, so they're going to discuss certain things.
Great.
And it will be a Q&A. You will have an opportunity to speak directly to the physicians. We are going to be doing the blood pressure screenings, like I said, a bunch of free health screenings. Like, if you haven't had your yearly checkup yet, this will be the best place to go.
Right.
And I encourage everyone to attend to these this health fair, because it's such a major thing to do, especially, and it's free. Free education, free giveaways, free activities for the children. And we want people to just get their health in order, and I want them to do it in the most comfortable way. We're also going to have a mini workout session, about 15 minutes, nothing too difficult, right? Just to get the blood flowing with Rye Fitness. We have partnered with them as well. And we are also having the agency for aging, they're going to be there as well with giving a wealth of information to our seniors. We encourage the seniors to come out. This is not just for the young adults, the mid age. It's for everyone. There's something for everyone that's going to be there.
And appropriate as well, because as I like to keep reminding that strokes couldn't care less what your age is. A stroke is possible. And one of the things that I have come to terms with over the years, and I see it in the parks, and I am most resentful, you see people with their walking aids in the park, they're exercising after the stroke.
Yes, yes, and this is the problem. We want prevention, right? Obviously, we can work on the solution after the fact, but this is a time for prevention. You don't want to get to the point where now you have to put in the extra work to get yourself back healthy. This is where you come out to the health fair on May 16th from 11 to 4 p.m. and get that information, get those free screenings, see where you're at, know your levels, and speak to a physician that's there so they can guide you in a preventative way in order to make sure that you are going to live the longest, most healthiest life that you can. And if for whatever reason you don't take heed to that, we still have the resources to help you after the fact.
But I need to present myself at this fair.
Yes.
I haven't come in a long time. I might just present. You never could tell anyway. But talk again about just some of the features. We have a couple of minutes left. Talk about the features that are offered at this health fair.
Sure. So we are going to have a physician's corner, like I said. We're going to have physicians there giving instructions and question and answer. We're also going to have proper nutrition. A nutritionist out there that's going to be doing a demonstration, also giving away free food.
You're going to have everything here.
Yes. Free food to give away so you can learn about healthy eating, healthy lifestyle. That's why we have that Rye Fitness coming out to give us a little bit of exercise. We're going to be doing monitoring blood pressure, blood sugar, cholesterol. We're going to be doing balance monitoring. We're also going to have Cleveland Clinic specifically is going to be doing the nutrition counseling. Dr. Ajiboye, he has been a godsend to us and the organization because he is a part of
He's a part of this now.
Right. At this point, we're family, and he has been such a great support. He is there whenever we need him, okay? And he's going to be giving the stroke presentation to educate everybody on what to do and where to go.
And he offers his presentations in a way you can understand it.
Oh, yes.
Oh yes, he's so good with that.
He's fantastic. He breaks it down so well.
Yes.
And it's easy to consume. And we're grateful for that, as well as we're going to have Nova doing some optometry. Some of the optometrist students will be out there helping you with your vision. They'll be doing vision screening. So literally, if you need your annual checkup and you have not gone yet, we're still at the beginning of the year. Do not miss this opportunity. Even if you feel like, you know what, I'm just going to go there for the live broadcasting of WAVS, and I'm going to go there for the entertainment, but I might just stop by to one of
Never
these
could
booths.
tell. Right.
Then
right.
by all means, please do come, because honestly, we've had this health fair for 12 years, and you'd be surprised that we've actually had people leave in the ambulance because we've been doing screenings and caught their sugar level high or their blood pressure high
right away.
Immediately.
Wow.
So we're in the process of saving lives. That's our goal.
Wow.
We don't want it to get to that point. We hook them up with a physician after that. They've been monitored. Their pressure is good.
That is so cool.
So it's
Wow.
something that we take personal. We lost our brother. My parents lost their son. You know, his friends lost their friends, their nephew, their cousin. You know, it's a deep cut for our family. But we're so appreciative of the fact that over the years we have been able to save many other lives, considering the loss that we've had in this process.
So good to have you coming. By the way, is there some kind of contact information you have for our listeners?
Absolutely. So the best contact would be to either call myself, Marissa Hylton, at 954-652-8646, or you can reach Carol Hylton at 305 798 4659. You can also reach us on our website at www.smileysvoice.com, and that's Smileys spelled SMILEYSBOICE.com, and the email address is also smileysvoice@gmail.com. Again, my number is 954 652 8646, and we are very excited and hope that everyone gets this information and decides to come out on May 16th from 11 a.m. to 4 p.m. And we encourage you to come early because we have a large crowd and a large following, and we want everyone to get as much information, as much free giveaways, as much as everything that we can possibly give you on that date.
Marissa Hylton, great information as usual. Thanks for coming in. We'll catch up soon.
Thank you so much for having me. You guys have a blessed day.
You too.